Are you experiencing chronic upper hamstring pain that just doesn't want to go away? You keep stretching the hamstrings and it's getting worse, not better? I'm going to show you how to fix it today. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of Oak Health, and today we're going to talk about an injury called a proximal hamstring tendinopathy. It's an injury that brings a lot of athletes into my office, whether they're runners, soccer players, weightlifters. It's a common athletic injury, and the thing that a lot of these patients have in common is oftentimes they come in and tell me that this problem has been going on for months. And this isn't a problem that you want to go on for months, and the reason being is that this proximal hamstring tendinopathy, which is basically an inflammation of the proximal tendon of the hamstrings. This tendinopathy the tendon can turn into what we call a tendinosis, which is if it's left irritated, you start creating micro tears in the tendon. Your collagen fibers, which should be straight, start getting disorganized. You basically start forming scar tissue in the tendon. Now you're more susceptible to tendon rupture and further injuries, and so this is not an injury you just want to not take care of. Now the reason it goes on for so long a lot of times with these athletes is because of the fact that, and if you've had this, you'll probably agree with this, is that it's a hamstring injury. So what do people do when their hamstring feels sore or it feels tight? They stretch it, and stretching is the exact thing that we do not want to do with this injury. And when I show you how we're going to fix it today, you're going to notice that it has nothing to do with stretching the hamstring. So this is the type of injury we have to kind of think outside of the box as far as how to fix this thing. And I'm going to show you how to do that today. So let's talk a little bit first about the hamstring tendon. All three hamstring muscles on each leg all converge and attach at the base of the pelvis at a spot that's called the ischial tuberosity. People sometimes call it the sit bone because when we're sitting down, we're on the ischial tuberosity, and that's where each hamstring tendon is. And so that's usually where we're feeling the pain of this injury. It's that high hamstring discomfort that almost feels like it's underneath the glute, and it gets aggravated. Activities, you keep trying to work out, you keep doing deadlifts, you keep kicking a soccer ball, and it just goes on and on, this injury. It doesn't get better, it gets worse over time. So how are we going to fix this thing? Okay, so first of all, the problem with this injury, or the causes of this injury, is more than just one thing. First off, oftentimes with this type of a tendinitis is we have some adhesions in the hamstring muscles. So basically over time, that nice stretchy hamstring muscle which attaches to that ischial tuberosity, as we do athletic activities, that hamstring muscle should be stretching nice and like an elastic band. But we build up adhesions, we have micro traumas from athletics, we have injuries, and we start forming, for lack of a better term, just knots in the muscles, adhesions. Adhesions are not stretchy material, they're fibrous, they don't stretch as well. Now that hamstring muscle, instead of stretching when we go to kick that soccer ball or any other activity, or when we're running fast, instead of stretching, that hamstring muscle starts tugging. Where does it tug? It tugs on that tendon. Getting back to stretching, why doesn't stretching help this type of problem? Well, as you probably know if you've seen other videos of mine, you can't stretch out adhesions. Adhesions are not stretchy material. It's like trying to stretch a leather belt. You could pull on that leather belt all day. Leather isn't stretchy. You can't stretch it. And it's the same with adhesions. You can't stretch something that's not stretchy. What you can do with adhesions is you can get in there and try to break it up. You can do some fascial release work. So one thing we need to do on this type of an injury is we need to do fascial release work on the injury. So we're going to go over that today, doing some fascial release work. That's part one of this problem, is how to fix it, is we're going to break up any fascial adhesions in the hamstring muscles. The other thing that goes on with these high hamstring injuries is oftentimes there's stress on the hamstrings because of tightness in the hip flexor muscles. Now this gets back to what's called an anterior pelvic tilt, and actually people with an anterior pelvic tilt are oftentimes more susceptible to these proximal hamstring tendinopathies. And I did a video on how to fix an anterior pelvic tilt. I'm going to put the card up above me. When you get a chance, watch that video. If you are suffering with an anterior pelvic tilt, you might find it helpful. But what happens is when the muscles of the hip flexors in the front get tight, they start to pull the pelvis this way into an anterior tilt. And when that happens and the pelvis starts going anterior, the ischial tuberosities start going up. And so basically as they're going up, they're putting extra tension on the hamstring muscles, which makes more pressure on the tendon. And actually stretching it, once again, getting back to why stretching doesn't work, stretching it just actually allows the hip flexors to pull that pelvis even more anterior. So the stretching is not what we want to do. Actually, part 2 of this is we want to strengthen the hamstring muscles to help bring that pelvis back into a normal position. So 1, break up fascial adhesions in the hamstrings. 2, we have to strengthen the hamstrings. And 3, we want to stretch the hip flexors to keep them from pulling the pelvis into an anterior position, putting pressure on the hamstrings. So those are the 3 things that we're going to do today. Okay, so how do you know if you have this? You know, if you want to just make sure, first of all, symptom-wise, you're going to have that pain underneath the glute, high hamstring pain. It's going to be an achy, very uncomfortable pain that's going to increase with certain activities. How do we test to see as far as if you have it? Just find an object that's about knee to hip height and just put a straight leg up on it and start stretching forward. You will, if you're suffering with this, you're going to feel an increase in that upper hamstring where that ischial tuberosity is. It's going to feel like it's under your glute. You stretch forward, you have the pain there. Another test you can do is just lie on your back. Just grab a strap, put it around your foot, bend your knee and your hip, lie back like this, and slowly extend out the knee like this. And as you slowly start extending it out, you're going to start feeling pain in that same exact spot. So either one of those is actually a pretty reliable test. If that increases the pain in that upper hamstring region, chances are you're dealing with this type of issue. And I'm going to go over right now how we're going to fix it. Okay, first let's do some fascial release on that hamstring area. I like doing fascial release on hamstrings sitting up on something so that the knee is bent, because I want to get some active motion. So I'm going to be extending out the leg here, and if you're on the floor, you can't do this type of work. So I like actually doing everything on the hamstrings from a seated position. So what I might do first, just to get some blood flow through the general muscle tissue, is I may start off with just on a regular foam roller, just sitting on the roller, rolling back and forth. That's not how we're going to break up the adhesions, but it's just a way we're going to warm up the tissue. So if you want, get a foam roller, spend a couple minutes just rolling back and forth on the hamstring muscle, and then we're going to move on to using a massage ball, which is the way we're really going to get into those adhesions and break up that tissue. So we're going to get in there. Of course, we're going to use a Tai Chi ball from Ocramed Health because of the awesome texture on these things, and they're small. We're going to be able to fit them in to the adhesions, and we're going to break it up. Now, when I'm on a table like this, it's a little bit padded. So to get the best depth of the ball, I usually sit up on a book. If you're on a hard seat, you don't need the book, but I'm up on this massage table, so there's a little bit of padding. So I'm actually going to get up onto a large book like this, and I'm going to start right up at that ischial tuberosity area, like right below it. So I don't want to be on the bone, but I'm going to palpate for the bone, and you can feel that ischial tuberosity, and then come right off of it, and I'm going to get that Tai Chi ball right on that area. If you're suffering from this particular type of injury, it's going to be uncomfortable. That tendon is inflamed, but we want to get in around that tendon area and break up some of that scar tissue and get some blood flowing into the tissue. So I'm actually, I found that ischial tuberosity, and I'm actually, if I'm sitting on the ischial tuberosity, I put the ball just a little bit below that ischial tuberosity. So it's on the soft tissue, it's not on the bone. And use your arms to control the amount of pressure down on the ball. And I'm going to spend about 30 seconds just kind of shifting my weight side to side, forwards and backwards on that tissue right in there. After I spend about 30 seconds doing that, I'm going to extend out the knee, and I'm going to hold it nice and slow, hold it for maybe 1,001, 1,002 type of count. And I'm just going to do that 5 times. And then once I do that, I'm going to take that ball and I'm just going to shift it a little bit off to the inside, a little bit more towards the inside. And I'm going to, again, for 30 seconds, shift my body weight side to side, forwards and backwards. And then again, I'll go 5 times, extending that leg out on that tissue. Now gauge your pressure. I'm using my arms to control my pressure. If you're suffering from this type of tendinopathy, you're in an area it's going to hurt. So just gauge your pressure. Next, I'm going to go off to the outside. So I started like right underneath the ischial tuberosity. Then I moved the ball in. Now I'm moving the ball kind of lateral out to the outside. Once again, 30 seconds of shifting the weight and mashing up that adhesion, mashing up some of those adhesions, and then extending the leg out back and forth. Once you do that, then you can just move the ball into different spots of your hamstrings. Now, if you palpate your hamstrings and you actually find some knots in there or some tender, tight areas, target it. Put the ball right where you find it. Get on the ball, mash it for about 30 seconds, like we just talked about, and then perform 5 knee extensions with your weight down on the ball. So you may end up hitting multiple spots if you palpate multiple spots. If the only spots you really feel are up near that ischial tuberosity, just pick another 4, 5, 6 spots along your hamstrings and just to do some release work on that hamstring. But usually if you're suffering from this problem, you're going to palpate several areas that are going to feel tight and tender on you. Those are the areas you're going to hit with the ball, and you're going to do some release, 30 seconds of mashing followed by 5 knee extensions. And that's how we're going to do the fascial release portion for this injury. Okay, so fascial release work on the hamstring followed by we're going to do some strengthening of the hamstring. Now, part of getting this injury better is we have to avoid those athletic movements that are aggravating the injury. That's going to help speed recovery. So in other words, if every time you kick that soccer ball, it aggravates the area, or every time you go to deadlift, it aggravates the area, we got to back off those particular things and do other things while this thing heals, because if we don't, we're never going to fix this thing. We're going to take 2 steps forward and 2 steps back, and that's why this injury can go on for months and months. So we have to avoid the activities. If you're a weightlifter, just avoid the movements that you know aggravate this. You know, I've experienced this injury many times. Oftentimes with me, I'll feel it when I'm deadlifting, and if it starts acting up, I just have to miss a couple weeks of deadlifting till it gets better. It's better to miss 2 weeks of an activity than 10 months of the activity because it doesn't go away. That's the way I look at these things. I hate not doing certain things, but I know that taking a couple weeks off is much better than having to take 9 or 10 months off, okay? So we're moving on to some strengthening exercises. These are real mild, gentle strengthening exercises. In fact, if they hurt a lot to do even these exercises, then continue on with the fascial release work of the hamstring until you can start doing these exercises. So don't force these exercises. If they aggravate it, you just wait and do more fascial release work and give it another week or so and then come back to these exercises. So basically the first exercise we're going to work is a bridge. So lying on the back, knees are bent up. We're going to press the hips off the ground. We're going to hold it for a 2 count, and then we're going to come back down. And we're going to do 3 sets of bridges. I would try to do high reps, so try to shoot for at least 15 or 20 repetitions, and we're going to do 3 sets of those. If that's feeling okay and you feel good and you're getting strong with that, then we're going to move on to one-legged bridges. So we're going to hold one leg out straight, and we're going to lift up with one leg, squeezing the glute and the hamstring, holding for a 2 count, coming back down. And what we'll do is we're going to do 3 sets on the left and 3 sets on the right. I don't care which side you're having the injury on. We always want to work both muscle groups. So bridges, and then move on to one-legged bridges once you're getting a little bit stronger. Also, what you can do as you're getting stronger and feeling better, you can bring in something to lift you up a little higher. Use a TheraBall. I just have a step here, something that you can put your feet up on. Like I said, you can use a TheraBall. You can just use a step like this and do your bridges in this manner so you can get even more range of motion. Coming down, coming up, holding it for a 2 count. Once again, high repetitions, at least 15 to 20 reps. and 3 sets. And then the next exercise after that, we're going to do a plank. And as we're in that plank position, we're going to lift up one leg and hold this position for 10 seconds, come back down, and switch to the next leg, 10 seconds. And we're going to alternate over the course while we're holding the plank. Now, if your core is weak and you can't hold the plank for too long, hold that leg up for 5 seconds instead of 10 seconds, because I want you to try to get at least 10 repetitions on each leg where we're holding the leg up. So if you have to only do 5 seconds, do 5. If you can hold it for 10 seconds and then switch and still get 10 reps on each leg. But this motion is going to work your core, which is important to recover from this injury. And also, by lifting the leg like that, you're activating your hamstrings, and that's a great exercise too. So those are the exercises that we're going to use to help start strengthening those hamstring muscles and we're not going to move into anything that's more of a weighted exercise at this point through our early recovery. We're just going to do some fascial release work, and we want to work those exercises that I just showed you. What's next is we have to loosen up those hip flexors, which are also causing a problem. Okay, hip flexors. When we're dealing with the primary hip flexors, we're usually talking about the iliopsoas muscle, the psoas with the iliacus, called the iliopsoas. So here's the thing. I did a complete video on releasing, stretching this muscle group. I'll put the card up above me. Check out that video if you want more detailed ways of loosening up those hip flexors. But the main stretch that we're going to do, and there's 2 things you have to remember on this stretch. One is while we're stretching, we want to keep the torso up nice and high. And the other thing is how we're going to rotate the leg, which I'm going to show you right now. Now, the reason being is that the psoas muscle is coming off the lumbar spine, and it comes across the pubic bone, and it attaches to the lesser trochanter of the femur, which is actually behind, almost in the back of the leg. So keep that in mind when we're stretching this, because a lot of times this is stretched incorrectly because of the attachment to the lesser trochanter, like I said, which is behind. And keep in mind, of course, that it's attached to the lumbar spine. So because a common way that people stretch the hip flexors is they'll get into this position and basically do this. So what's wrong with this stretch? Okay, a couple things. One is my hip flexors are attached to my lumbar spine. So if I drop my torso forward, I'm not getting a full stretch. If I'm going down with my torso, I'm taking away the stretch. So first off, I want to keep the torso up straight and stretch forward, so that way I'm getting more of a stretch through the psoas. As I drop it, I'm taking the stretch away. So it makes no sense to be doing this. That's not a good way to stretch it. So first off, the torso has to remain upright so that you get maximum stretch on the psoas muscle. Second, that muscle's attaching towards the back of the leg. So I find it very important when you do this stretch to have the leg rotated and bring the lesser trochanter in a position where it's facing towards the front. If you're in this position, the muscle's wrapped around your femur, and you're not going to get as good of a stretch because the muscle's wrapped around the femur. But if you bring the leg into this position, and I'll show you from the back. So if this is the way most people do it, I'm going to rotate the leg in this way. So that's the position I'm using. So I'm here, I'm going to rotate the leg, the femur this way. So I'm basically externally rotating my hip. And now I'm bringing the lesser trochanter where it's attached in a plane, in this plane here, which you're going to get a much better stretch. So if the leg is in this position and my torso is up, a lot of times I even like to stretch my arms overhead. And now I go to lean forward. I'm going to get a maximum stretch on the hip flexors. I'm going to come into this position. I'm going to square my shoulders forward, torso's up, leg is rotated. I'm going to hold this for about 20 seconds. And I'll do it about 3 times. Of course, I'll do the other side also. If your one hip flexor is a little tighter than the other, spend a little more time on it. Now, when it comes to this injury, sometimes the tight hip flexor is on the same side as the hamstring tendinopathy. However, sometimes the tight hip flexor is on the opposite side. So if your opposite hip flexor is tighter than the side of where you actually haven't. That's not unusual either. So you could have a left upper hamstring tendinopathy, and your right hip flexor might be even the one that's causing the problem. So a lot of times it's on the same side, but other times it's actually on the opposite side. But either way, stretch both of those hip flexors like I explained it. You're going to notice that's going to help this injury a lot. All right, so there you have it. Now don't forget, this is usually an injury if you've been experiencing it. It's been going on probably for months. So do not expect that you're going to do everything I went over and you're going to do it for just a week and all of a sudden your injury is going to disappear. It doesn't work like that. This is something that's going to take a little time. You're going to have to do what I showed you to do, but you're also going to have to do what I mentioned. You're going to have to avoid some of those activities that is aggravating it. And that goes to most tendonitis type of injuries. Part of the recovery is avoiding the activities that aggravate the injury. If you do that, you're going to get better quicker. All right, if you're enjoying these videos, please subscribe to my channel, Med Health on YouTube. Questions about exercises or injuries, just leave a comment in the comment section below. I always get back to everyone who writes in. And don't forget, Med Health is here to keep you fit forever.